King here. Today I'm going to take you through a spine and lower body foam rolling routine that you can do pre-workout, post-workout. That would be ideal. Or you can do it in the morning, or you can do it on your lunch break. You can do it whenever you feel like you need to, but ideally it's going to be pre-workout to help warm up tissue on leg day, and post-workout to help decrease muscle soreness. Two things we got to remember when we're doing this is breathe. Don't hold your breath. You're not underwater, so breathe. Second is, as you are doing the foam rolling, you're going to hit some tender spots. Might be a little uncomfortable. You have to remember, no pain faces. I mean, if it's really hurting and you're gritting your teeth and your eyes are watering and all that stuff, it's too much. Back off a little bit. But if you can handle it and it's tolerable, be stoic as hell. No expressions, be totally expressionless, or happy smiling face. Reason being is that when we're making pain faces and gritting our teeth, it can wind up our sympathetic nervous system, which will amplify the way that we feel, and in this case, it will probably have a negative effect, not a positive one. It'll make it feel worse, not better. So no pain faces. All right, guys, let's get right to it. So we're gonna start with our spine. So you're gonna be perpendicular, parallel to the foam roller. All right, I'm gonna start up high. You're gonna put your hands behind your head. So one thing you want to remember is that you don't want to super arch the low back, and you don't want your ribs to be flared. Okay, so you want to tuck your pelvis, posterior pelvic tuck, and you want to breathe in, breathe out, and get your ribs to your hips. You don't want flared ribs. You need to keep this position the whole time as best you can while you're doing this whole routine. So we're starting up high, pelvis tuck, ribs down. So you're going to inhale, one vertebrae over the foam roller. Notice my ribs did not flare. As I exhale, just going to inch myself up, next vertebra. Going to repeat the process. Inhale. So it's almost like I'm doing a crunch, but I'm not letting my ribs flare up. So inhale. Notice my ribs are still down to my hips. Exhale. Inch up, or down. Inhale, pelvis tuck, ribs down. Now we're going to go back down or up our spine. Inhale. Oh, you got to be careful because your shirt might get caught under the foam roller. I was going to do this shirtless, but I didn't want to scare anybody. So here we go. Repeat the process. Pelvis tucked, ribs down. Inhale. Scoot down. Big inhale. Now notice I'm not doing this. Okay, my spine is staying as neutral as it can, and my fulcrum is my thoracic spine. Good. So now we're going to get a little bit of our lateral tissues. You can keep the same position, hands behind your head. But now we're just going to lean over a little bit. We're just going to kind of rotate to the side, and we're going to do just a general scan first to see what we feel in the tissue. Maybe you'll feel some tightness, rib area on the posterior side. And if that is what you're feeling, you're going to adjust the foam roller as you go. Okay? You're going to do little tiny scrubs. Back and forth. Okay? Pelvis still tucked, ribs still down to the hips. I'm not flaring like this. Okay? So you're going to get a little bit of a workout right here just doing this. Good. See what you find. You can even kind of come over, lean over a little more if you want. Get those lats, serratus anterior, a little bit of the ribs. See what you feel. Oh, I got some tightness right there. I found a spot. So it's nice and tender. So I'm going to hold here. I'm going to breathe. Remember, no pain faces. Just breathe in. Now I'm going to add in a little bit of movement. Okay? Almost like I'm doing a little side crunch here. Still breathing. Maybe I want to get a little more. Get it really on one of these nubs. All right, let's move on. Now let's check out the other side, see what we're feeling. Again, we're coming in at an angle. Check your shirt so it doesn't get caught. All right, see what you feel. Don't be surprised if one side feels different than the other. You know, maybe you find a little bit less lumps and bumps, a little less tenderness. It's pretty normal. Got a little bit right here in my lat, serratus anterior. So I'm just gonna breathe. And so notice here, my ribs are lifted. I'm not sagging into the ground. My ribs are lifted, pelvis still tucked, ribs still down, so I'm breathing. Now I'm just gonna kind of rock side to side. You can add in a little bit of movement. I call these scrubs when you kind of move back and forth. See what you feel. Got one right there. All right. So we got our spine all nice and warmed up. Now we're going to move on to the lower body. We're going to start by hitting up our right glute. So you're going to make a bit of a figure four. And again, you're just going to kind of do a general scan. See what you feel. Remember to breathe. Not holding your breath. You can kind of grab your leg, bring it over. Just get a different angle on some different tissue. You kind of come down a little bit. And right here, the top of my pelvis, getting the glute. Oh, I found a tender spot right there. So when you find those tender spots, you're going to kind of just dig in. You're going to mash. Now I want to add some motion to this to help release a little more tissue. So I'm just going to move my knee in and out. Make sure I'm breathing. Not holding the breath. A few reps here. Do some tiny scrubs. All right. So now I'm going to rotate a little more onto my right side. Get some of that hip. So my focus is right here. But just explore and see what areas you find that are tender. When you find one, I found one there. Notice that I'm not sagging like this. Again, I'm up, I'm active, my ribs are lifted. So I found a tender spot right there. I'm gonna do a little bit of scrubs. I'm pushing up out of my shoulder. Okay, I'm not sagging into my shoulder. Pushing up. Doing some little scrubs. Now I'm kind of finding some different angles here. Move your body around, see what you feel. All right, now I want to add some motion into this. So I'm going to bring my knee to the foam roller. Move it up. You can do some rotation. Again, ribs lifted. Use an abduction. Just help get some motion into the tissue. Okay, I'm going to roll back onto my glute. And we're going to hit up a little bit of the hamstring. So I'm going to start here at the top. Now, hamstring can be hard to get. It's hard to get enough pressure to really feel like you're doing much. So I always rotate a little bit, kind of get the lateral aspect of the lateral hamstring, so between the back of my leg and the side of my leg. So notice I'm kind of leaning over a little bit. Some people, you can go like this. You want to be more on both bellies of the hamstring. Kind of move around, see what you need to do to get more pressure. Hamstrings are a really hard muscle group to get, but now I also kind of want to go to the inside. So I'm getting starting to get a little bit of my groin, or my abductors, and my medial hamstring, the inside of the hamstring. Now if I want to add some motion to this, the hamstring, to get both heads instead of just being flat on, you're going to add, so I'm rotating my leg to the right. I'm not turning my foot, I'm turning my hip inside, outside, inside, outside, inside, outside. Go all the way up and down the hamstring. Go on the outside, see what you feel. Go on the inside, see what you feel. So I'm feeling a lot of tenderness on the inside here on the medial aspect of my hamstring and my lateral aspect of the adductors. So I'm going to show you how to get that. So I'm just going to flip on over. Now to get the inside, the groin here, you're just going to bring that leg up. You want to get it up into that hip groove right there as best you can. And then we're just going to explore this. This might be a little rough for some of you. That's okay. Remember, breathe. We're not underwater. Don't hold the breath. Again, I'm not sagging my low back into my stomach into the ground. Okay, I'm active. My glutes are squeezed. I'm breathing. My abs are contracted. Just finding these tender spots. All right, now let's get some movement. This is also going to get vastus medialis too. The lower we get in here. So let's get some movement. You can straighten your leg, bend it, straighten, bend, straighten, bend. Okay, maybe we want to get some internal rotation of the hip right in here. Good. Keep on rolling. So now, since I'm already in this position, oh wait, I found a tender spot right there. So you find that tender spot, you remember, when you find it, you're gonna hold on that tender spot, take a couple of breaths, 1 or 2. And you wanna drive in a little bit. So this is uncomfortable. Remember, I'm not making pain faces. Just breathing, hanging out. It's uncomfortable, but it's tolerable. Let's get some motion in there. Little tiny scrubs. All right, so now we're gonna go right onto the quad here. It's gonna shift right back over. So now we want to start again way up here in your hip groove. Okay, so I'm pushing down into that. Also, watch the shirt. It's probably gonna get caught here. All right, so you're just gonna kind of dig in, do some scrubs again, kind of find some spots. See what you feel. I got some tenderness right in here. So I'm breathing, doing a little tiny scrubs, seeing what I feel. I'm gonna hit the door, so I gotta rearrange here. Again, I'm in there. I'm gonna just kind of move up. So right now, I'm just directly center of my quadriceps. Just kind of doing a general scan, seeing what I feel. So I got a tender spot there. Now let's add some motion. So notice how I'm also kind of doing like a plank here. So I'm working this whole time. So you're breathing, you're not sagging, okay? You're tucked. So let's add some motion. Okay, you're gonna do some side to side motion here. Ooh, yeah, right there, tender spot. Yeah, that doesn't feel good. Ooh, happy smiling face. Or no expression at all. Okay, so that's pretty tender in there. Just do a few reps here. All right, let's move on. Now we're gonna kind of get the medial aspect of the quad. Maybe a little bit of adductor. So I'm not really feeling a whole lot of tender spots in there, so I'm gonna spend less time there. Oh, I got some right there. Keeps rolling over. So I'm gonna add some motion here. Remember, we're breathing. We're not holding our breath. We're not underwater. Okay, add some motion. So now I'm going to go onto the lateral aspect of my thigh, IT band area. So I'm just going to roll. Okay, again, same thing. See what you feel. You know, I'm going to do this the other way, so that way you're not staring at my butt the whole time. I've been doing a lot of squats lately, but I'm not trying to show off the glutes here. So again, now we're just going to kind of do a scan, see what we feel. Again, you're working, you're not sagging down like this, all right? You're pushing up out of the ground with your shoulder, just kind of seeing what you feel. Now, IT band area, which is what I'm working on, kind of lateral aspect of the quads. It's always usually pretty tender on a lot of people. Again, when you find those tender spots, like I got a really tender one right here, just breathe, don't hold your breath, add some motion. It's probably gonna hurt more when you do that, because for me, it's that increase the intensity a little bit. Remember, if it's too much, back off, don't push so hard. All right, so just kind of go all the way up, see what you feel. All right, then we're gonna go right back down. Good. Now since I'm on the lateral side, I'm going to work peroneus longus and brevis, fibularis longus and brevis for you new kids on the block up there. So same sort of thing. General scan here. See what you feel. These are usually pretty tender spots on a lot of people. If you're running a lot, walking a lot, doing a lot of activity. So I got a tender spot right there. So I'm breathing. And so those tender spots, they may radiate pain. You may feel that pain go other places, maybe like a kind of a throbbing, kind of tingling sensation. Those are called trigger points. And so right now when I'm pushing into my peroneal muscles right here, I feel it in my pinky toe and my second to last toe. That's called radiating pain. Oftentimes it gets confused with nerve pain, although nerve pain and muscle radiating pains follow a similar pattern. Anyways, you may feel pain in other places, what I'm trying to say. But don't worry, it's not sciatica. So we're just going to keep going, go down, go up. So I'm going to add some motion here. Oh, that's going to really intensify this. Still on the side of my leg, right in here. I'm really digging into one of these nubs. So now I'm just going to do some circles. All right, let's move on. Find a new spot. I'm going to get more in my calf area. Calf, soleus, or gastrocnemius, I should say. Let's be professional here. Gastrocnemius and the soleus. All right, so now I'm kind of over on the lateral aspect where the peroneal muscles are meeting the gastroc and the soleus. And just doing a general scan, I got a tender spot right there. Now I'm more flat to the foam roller. All right, so I'm just going to point my foot toward my head. And again, I'm not sagging here. Okay, let's be active. Let's breathe. Okay, go. Let's explore. Go down. Really tender down in there. So this is going to be really good to do before you go run. If you foam roll your calves, your legs in general, but really focus on the calves. Do some ankles, circles one way, ankle circles the other way. Just check it out, see what you feel. So now I'm kind of going on to the inside of my leg. Really, I'm really sore up in here on this top spot. So the more sore that you are, the less pressure it's going to take. So right now I'm not even really pushing down into the foam roller. Just kind of doing some general scans. This is just going to help increase some blood flow. So when I push into here, I feel that in my big toe on the lateral and posterior side of it. So now I'm kind of on the inside of my leg. Just for clarification, this is your thigh. This is your leg. It's not your leg. Leg. So now let's do some more ankle circles. All right, so we just did an entire side here. Let's move on to the other side. So we're just going to start the same way we start on the other side. Let's get in that glute. Again, figure 4. Kind of general scan. So this side is a lot more tender than the other side. So just notice that. We're always going to have these differences in sides because of our movement patterns. The way that we move, everybody's different. So where you feel like a stretch or something, or where you feel this, it's not going to be the same on the other side most of the time. So we're going to kind of scan here, lean down a little, get that glute medius area. Your glute, there's 3 glutes. It's not just the glute. There's 3 different glutes. Maximus, medius, minimus, and they all do something different. All right, so I'm going to move on kind of more on the lateral aspect into my TFL, glute medius area. Starting to get the lower aspect of the glute max. So I got a lot of tenderness right in there. So I'm just gonna hold here, take some breaths. Again, notice I'm not just sagging, sunken shoulder. It's gross. We're pushing up out of the shoulder, being active. We're breathing. Ribs down. Our ribs aren't flared. Ribs down. So I'm just gonna add some motion here. Straighten, bend, straighten, bend. And then let's move on. Do a little bit of scrubs here. And get on the side, see what we feel. Not really feeling a whole lot over there, so I'm going to spend too much time. So I'm going to get more my hamstring now. I'm going to get where the sits bone essentially is where I'm on. I'm right near that landmark. It's where the hamstrings are going to come meet the glutes. How you can think about that. So that's usually a super tender spot for most people. So I'm like right over here at the very top of my thigh. A lot of tenderness in there. So again, you can try to figure out how you can get more pressure. If you need it, hamstrings are tough body parts to get a lot of pressure on. So I'm also kind of going to the inside of my thigh. So remember, I don't even know if this is how I did it on the other side. Could be. You know, doesn't really have to be complicated. Just foam roll. Just find the spots. So I got a real tender spot right there. All right, that's on the medial aspect of my hamstring. Just kind of getting some scrubs in, hold some pressure, take some deep breaths. All right, so now we're gonna get the abductor area, inner thigh. So again, we're just kind of feeling, do a general scan, see what you feel here. Again, we're being active. We're not sinking down towards the ground, pushing up. So I'm not really feeling a whole lot of really anything. I'm going to get way up high in that hip groove, see what I feel. I'm not really feeling a whole lot. So remember, when you don't feel a whole lot, you can just spend 30 seconds or a minute on the area. Oh wait, I found something right there. So again, I'm almost like doing a plank right here. Breathing in, let's add some motion. Good. Keep breathing. Don't hold your breath. You're not underwater. Add a little bit of scrubbing. All right, now let's get right in that hip groove. Go. I got something right in there, so we're gonna breathe. Let's breathe it out. A little plank action. All right, so now I'm gonna move on to the quad focus here. So remember, I'm gonna get right up into that hip groove. See what I feel. You know, rotate different angles. Okay, go up right on that lateral aspect. Right on that lateral part of the thigh. That's good. This area is usually pretty tender on a lot of people. So spend some time here. Let's do some knee to chest. Get the leg moving back and forth. Good, don't hold the breath. You're not underwater. You're pushing up out of your shoulder. Your ribs are active. You're not sagging down. Okay, you're active. Now we're going to move on. More quadricep focus here. And right now I'm more center on my quad. General scan up, general scan down. Kind of rotate to the lateral side. So this is more vastus lateralis. Down there at the lower left aspect of my left thigh. So I got a real tender spot right here. So I'm going to breathe. No pain faces. Stoic. Expressionless. Now let's add some. Oh yeah, buddy. That adds the intensity right there quite a bit. A few movements here. Let's do some internal, external rotation. Now notice I'm not sagging into the ground. I'm active, pushing up out of the shoulders. All right, let's go on the lateral thigh. Again, IT band. People are told to just roll the hell out of their IT bands if they're getting IT band syndrome, which is pain in the lower left leg, and that's usually not the problem. So you will find some tender spots. Oh yeah, I forgot. I'm showing off the glutes here. Let's go like this. So on quads. Guess it doesn't really matter. I work hard for my assets. All right. So again, It's foam rolling. Alright, so I'm not really feeling much. So I'm just gonna move on. Gonna get the left leg. Right now we're gonna start on the calves or gastroc, soleus muscle group. And if you notice, I haven't really stayed in one spot the whole time. I've been moving around this whole time, and that's what you should do too. All right, find different angles. Don't just be stuck in one side the whole time. Okay, right now we're just doing a general scan. See what we feel. I got a lot of tenderness in this calf compared to the other side. So I got some tender spots right here. I'm gonna point my foot toward my head, point it down toward the ground. Again, be active out of your shoulder. No sinking. You don't want to be doing this. Okay, we're pushing up out of the shoulder. Okay, let's do some circles. Circle the other way. And so I'm going to go to the lateral aspect. Got some tenderness right in here. These are always pretty tender on me. Good. Just kind of doing a general scan. And this whole thing, not so much in the center right there. I got some tenderness up here at the top. So we are going to do some circles, pushing up out of the shoulder. You want to see how you can figure out maybe get a little bit more pressure here. Do a side plank, essentially. Side plank it. Drive the leg in on the ground, up out of the shoulder, ribs lifted. Do some circles. Good. Let's kind of move on. That's pretty tender in there for me. Let's take one more breath here. If it's not tender for you, keep moving. All right, find what's good for you. Okay, so now we're gonna, oh man, as soon as I turn on the inside of that leg right there, super tender. Yeah, right there, real tender spot. These muscles on this inside part, flex your hallucis longus, move your big toe. There's three main muscle groups: tibialis posterior. It's on this side, always really tender on a lot of people. General scan. Oh yeah, right there. So if they say, you keep doing your general scan. I found a tender spot. You're just gonna find one. We're gonna keep going. All right, guys. So that concludes the foam rolling session. I know we covered a lot. Remember, do this post workout, or whenever you feel like you need some movement in your life. Take your time. The same movements that work for me may not work for you, so you got to figure it out on your own. Otherwise, thanks for watching.